Well, good morning, everybody. Good morning, Dr. Susanne.
Good morning.
Thank you for being here with us.
Thank you.
You are a veteran of shoulder rehab and treating the shoulder effectively and well. So the first question we have for our audience is, what are the most common two things that you would say that you see as far as injuries to the shoulder?
Thank you. Usually the number of one is like I can't reach my arm overhead. It hurts when I lift above my head. And the other is I can't sleep on my right side, or I can't sleep on that shoulder at night. So those are usually the most common things that I hear as a therapist.
Okay, that's great. So maybe share with us, clinically what potentially could be going on with that, either reaching up or when you're sleeping on it. What in terms of a therapy standpoint, but we want to keep it simple for our audience, what is usually going on that's causing that difficulty?
Today, most of the time I see it's related to posture and just some stiffness and tightness in the shoulder that can be corrected with some exercises. Often when I hear pain at night, it could mean that there's an underlying inflammation, there's some swelling, possibly from overusing, possibly from an activity of using the shoulder a lot. As we age, our posture changes, and there are greater impacts in how well the shoulder can move overhead, but that can be changed with some simple exercises.
Great. Well, Dr. Susanne, why don't you educate us a little bit about the unique aspects of the shoulder and the joint itself, and yes, we do have a model here if you want to refer to that, but just give us a kind of a little overview of the shoulder joint.
Okay. Well, simply, the shoulder is more than just one bone. It's three parts, and many times we hear the collarbone, but in medical terms we call it a clavicle. You hear the shoulder bone, but in medical terms it's called a humerus. And then the back of the shoulder is called the wing bone, which we call the scapula. And all three parts work together to form the shoulder. Most significantly, as we age, sometimes things start to change, and joint motion can become compressed or smaller. And for example, with the shoulders that are forward and rounded from use of computers, this can change the positioning of how the shoulder sits in alignment to the spine. Subsequently, it can reduce the space and start premature, maybe some arthritic changes in the bone, or some swelling and irritation in the tendons that run through it.
So, you mentioned posture, and I was kind of resonating with, the idea that our body position can adversely affect, probably irritate the joint, correct?
Correct. Many times the shoulder pain is related to something underlying. Now, granted, there are overhead sports, repeated activities at work, crafts, jobs that we do, lifting all the time, that can put a lot of stress on the tissue compared to the other side. And that's not unusual to see pain just because of the overuse. But for traditional, just not necessarily working, there's a lot of postural changes that start to impact the movement of the shoulder. So as a clinician, what is nice is we have the opportunity to assess more than just the shoulder, but kind of everything that connects to it, including the neck, the spine, and all the way down into the hand. And it's not always just one body part that's affected, but that's the primary source of pain.
I remember, Dr. Susanne, that I recently had some shoulder pain, and you checked the strength of my hip, and sure enough, we found weakness in my hip on the side that I was having the pain on the shoulder. So
correct.
That's pretty remarkable.
Yeah.
And I do want to throw in a little shout out to us as doctors of physical therapy, because we're probably unique in the sense that we really look head to toe.
Correct.
And I can't say that others don't do this too, but certainly here at Allied we really take the whole body, look at everything, and determine how is that impacting your primary complaint, in this case the shoulder.
One of the things to to add on to that is the fact that oftentimes we'll see in an MRI or an X-ray, particularly X-rays, signs of arthritis. Well, the arthritis could be there, but that doesn't necessarily negate that that's the source of the pain. Many times we do have arthritis as we get older, but there could be other soft tissues that aren't seen on an X-ray that are actually causing more of the pain than the actual bone. So there's an importance to having a clinical assessment to know the full scale of where the source of pain is coming from, not just an X-ray and imaging.
Talk a little bit about, if I experience some shoulder pain, what should I do? You know, should I call the doctor immediately? Should I take some sort of medicine or heat? What should I do in the case of I been working in the yard and Monday and I'm like, oh man, my shoulder's hurting.
I normally will recommend some rest and ice 15 minutes, maybe 2 or 3 times a day, and also to provide some support for the arm such that it's not down by the side but on some pillows, so that'll give the tissue an opportunity to relax and not be under tension. There's some simple things of just beginning to squeeze the shoulder blade muscles, and that can start to bring the shoulder back into its normal alignment. And even neck muscles can get stiff, and certainly these are not detrimental but can be very effective just to start creating some movement. We call a movement where you just kind of swing your arm gently by your side, and that's a pendulum which opens up the joint and brings some healing into it as well.
And what point do you think we should call the doctor or certainly a physical therapist? What would you say, yeah, you probably should take the next step after you've tried these different exercises and ice and maybe some anti-inflammatory?
Typically, if pain is overnight and it's constant and or waking up with pain, if there's pain every time you go to reach forward or across the body and it's just a constant, definitely I would say get some help, seek some help, whether it's directly to a physical therapist or directly to your doctor to examine and institute something before it possibly can get worse.
Well, thank you, Dr. Susanne. I do want to point out that Dr. Susanne has written a nice book. It's very simple and practical, and many of the concepts she just talked about are in this book. So go to our website, you can download it. And certainly if you want to see Dr. Susanne in the flesh, call the office. She would be happy to work with you. And we thank you for the time tuning in and taking and making your health a priority by watching this video series. So thanks again for tuning in, and be sure to share this video with a friend.
Thank you.